After performing resisted neutral testing and finding weakness in wrist ulnar deviation, we can perform manual muscle testing to assess wrist ulnar deviation. The first test is for the flexor carpi ulnaris muscle. Have patient's forearms supinated and supported on a table. Their wrist should be extended and the fingers and thumb relaxed. Stabilize the forearm and palpate the flexor carpi ulnaris muscle. Have the patient flex and ulnarly deviate their wrist through range of motion. Then have the patient flex their wrist and ulnarly deviate, and the therapist applies resistance over the palm of hand in a direction of wrist extension and radial deviation. The next manual muscle test involves the extensor carpi ulnaris muscle. Have patient's forearm pronated and supported. Patient's wrist is flexed and in radial deviation. Stabilize the forearm and palpate the extensor carpi ulnaris. Have patient extend and ulnarly deviate through range of motion. Then have patient extend and ulnarly deviate while applying resistance over the dorsal aspect of the hand towards the direction of wrist flexion and radial deviation. Have patient's forearm in slight supination supported on a table. The therapist should stabilize the forearm proximal to the wrist. Have patient flex the wrist with ulnar deviation through full range of motion. Have the patient's forearm in slight pronation supported on a table. While the therapist stabilizes the forearm, have the patient extend the wrist and ulnarly deviate through full range of motion.